And Moyra really worked hard on this, and I'm sure she got it in eventually, but the nursing staff just couldn't see how a music therapist would have any input into how to, as a team member. And not only music therapists, but OTs or, rec therapists. It was like, no, you're just not part of the team. You know nothing, you can't take over. They saw it as us taking over their job, stepping into their responsibilities. And so I know we had lots of meetings about that where, that our input would be on a different level than your input, which is you've always, taken care of the physical side of things and hopefully the mental side, but other therapies can handle other things. But yeah, so they felt quite threatened by this team idea. Because I have to say, when I got there, people were really skeptical, really skeptical. They just weren't sure what, they thought it was a waste of money, and anyhow, little by little, things were won over. And I think I mentioned earlier, for a few years after, if I would meet any of the nursing staff out in public, I remember 3 times people apologizing to me and saying, I'm sorry we were so miserable in the beginning. We really realize now what music did for people. So you can see, it was a struggle. It was a struggle in the beginning. And then when Moyra was hired, of course, then things really ramped up. And by then people have obviously appreciated the value of the creative arts. I think she was very clear about her mandate. And also she was very clear on how to do in-servicing. So she introduced programs, in the proper way. She would do in-services for staff and kind of try to bring them on side. And by then, people were warming up a little more to what could be available to these people other than just nothing. And what was good for physical, their physical health. And because, a lot of them were ambulatory and looking for things to do. And so I think she obviously did it the right way, because her program, I left shortly after she was hired. But I know her program was very successful after that.